H. H for hygiene. So what's different between the Epic H and the Epic X? Number one, wavelength. Very, very important. So especially if you're a dentist and you want to do root canal, I would say definitely you want to stay with 940 nanometer, because we've found in the studies that have been done that 940's ability to penetrate deeper into the root canal and vaporize that bacteria is the wavelength that's needed. So the 980 nanometer, and why 980? Well, because BIOLASE is looking for a cheaper diode laser for the markets, particularly people that just want to do a few procedures like perio, and they don't really want to do TMJ and teeth whitening, although this could be done with teeth whitening, but only single tooth instead of using the bigger handpiece, so it'll take you a bit longer. So the other big difference is the power settings. You'll see even if I go to continuous wave and I go to maximum I can get here is 1.5 watts. Now that's perfectly fine if you're doing surgical procedures, gingivectomies, phrenectomies, etc. But if you're doing perio procedures, but when you want to put the bigger handpieces on here, the ones we use for TMJ and teeth whitening and so on, that's just not enough power. However, you could probably do some spot treatments at lower settings, and you could do these particular joints. So there is a way around it. But once again, if you're a dentist and you're going to do root canal particularly, and you want more power to do other types of procedures, stick with the Epic X. And if you're a hygienist or a dentist just wanting to do perio, if you're limited procedures, this laser is wonderful. Similar to the Epic X, it is totally portable. You just plug it in and it gets flat, take it from room to room. The foot control, same as the Epic X. Even this surgical handpiece, the same. So just some quick tips. Always keep this red cap on it because there's dust in the atmosphere and aerosols. The big talk now about COVID, we're all looking at cutting down aerosols and just the dust and so on. So this cap prevents dust from getting in here because there's a little window there and the laser energy comes through, and if you think about a dirty window, light wants to come through. If it's dirty, it's got to go somewhere, it'll bounce back down and you could damage your fiber. So always keep it covered. Also, if you drop it to something, if it's got this on, it'll be protected. And we also advise you, and that's why there's a reminder, a little tag on here, because you should be cleaning that little window there. Take your applicator brushes with some alcohol, 99% alcohol, and just go in there and gently move it around, clean it. Also because when you screw these tips in inside here, this is metal and this is plastic. So you get these little filings that actually come inside here, and gently these filings will drop down into this window, and then the light can't come out once again. So it's also advisable to just take your air syringe and just clean this out from these little minute little pieces of plastic that eventually build up in here. So once this is on and you screw on your tip, then always wear the glasses with this laser. So the wavelength is normally depicted on the side, which they protect you from. So these particular ones from BIOLASE will protect you from 940 and the 980. And another important thing is high volume suction. So besides just the talk about all the aerosols that it's helping to suction up, you also get what we call the laser flume. So the last thing you want to do is when you're doing a procedure and the patient smells, particularly some tissue that's overheated, that's not a nice experience. But besides just that, the other benefit of this is when you're working on tissue, whether it be a gingivectomy or phrenectomy, anything, keep the high volume pretty close, because it also sucks cool air over the tissue. And if you have cool air over the tissue, you're going to have less post-op pain, you get less damage to the tissue. So the other benefit is even you could use your syringe, your air gently, not water, just the air. And what we often do is if you've got a nurse that can hold suction on one side and air from the other side passing through, we find that the tissue remains quite a lot pink. You get a bit of browning, but the browning is fine because that's coagulated blood. And don't be tempted to take some gauze and wipe that, because then you will start the bleeding. In a couple of hours that will look quite pink, but you don't want that carbonized black dark tissue, because then you've overheated the tissue. So high volume suction is your friend. Okay, so a treatment that's become very popular is LBR, or otherwise known as laser bacteria reduction. So what is that and why do we do that? So a patient comes in for a scale and polish, sits down, and I know now there's a talk of giving them a mouth rinse and so on to lower any viruses and so on and bacteria. But your laser is also wonderful for that, in treating and destroying virus, bacteria, and fungus. So you definitely want to use this laser. So, patient comes in, scale and polish. Let them do their rinse, whatever you're prescribing nowadays. Then you put on your tip, and we would put normally a longer tip, 7 or 9 millimeter. It also depends on how deep the pocket is. So, something I learned many years ago training the vets is that if you stay subgingival and you keep just going from tooth to tooth, eventually an uninitiated tip becomes initiated. And then it's a hot tip and it's a cutting tip. And you don't want that to happen, especially if you're doing a perio treatment and you're close to the bone or even around an implant. You want to make sure it doesn't become a hot tip. So how do you prevent that from happening? Okay, so when you go into the pocket, or you're just doing laser bacteria reductions, you might only be going 1 millimeter or even 0.5 millimeter. Just do one tooth at a time and keep some wet gauze with water. Gently squeeze it and put it out. That will prevent this tissue buildup that comes on the tip. Because if you don't do that and you're staying subgingival, that tissue builds up and it becomes an initiated tip. Also, if there's some dark calculus below the surface and you go against that, we train you guys on using articulating paper or the cork, although we would advise articulating paper, and it's the pigment that it's seeking. So it burns that carbon layer on the tip so the light can't come through. So then we have a cutting tip. So when you're doing perio, you don't want a cutting tip in terms of this procedure that you want to do. So the laser, one tooth at a time, take it out, clean it. Then the next tooth, take it out, clean it. And that will help you, in most cases, that the tip will not become self-initiated. So why are we doing laser bacteria reduction? Number one, we're lowering the bacteria count. Okay, there's numerous studies that show how well this particular laser wavelength, or most diode lasers, are at destroying bacteria. Number two, we're desensitizing the teeth. So when you put your scale in, it's not so sensitive and traumatic for the patient. And number three, we've also found that it has an interaction that appears with a protein that's inside the calculus which acts kind of like the glue in the calculus. So when you then put your scaler in, the calculus comes off much easier. It's not so traumatic that it would normally be without using your laser. So there's quite a few benefits. And then once you've done that, then you'll do your normal scale and polish as you would normally do. And because this laser only goes to 1.5 watts maximum, we wouldn't generally use the big handpiece on it. But if we're doing low-level laser therapy, or otherwise known as photobiomodulation, we could still use that, what we would call the whitening handpiece. So laser bacteria reduction, you've completed that, and then you will take your scaler, and then you will use your scaler and do your polishing. And what you can then do is do photobiomodulation. So you could also use this handpiece by taking off the tip, and then we would put a setting here of usually 0.5 watts, and would go one tooth at a time, could go around. Or if you've got the bigger handpiece, what we call the whitening or contour handpiece, we can do a quadrant area at a time. Then you would have to add that handpiece. The benefit of having that handpiece, you can do a bigger area in a shorter amount of time. So although you're restricted here in terms of the power compared to the Epic H, which can go up to 10 watts, there are ways and means of doing it with this one. But once again, if you're a dentist and you're going to do multiple procedures in TMJ and endodontics, we would definitely advise you want a 940 nanometer. If you want to get this for your hygienist and come in at a diode laser that is lower cost than the Epic H, it's a wonderful solution for you.